Over the past few weeks, we have witnessed the emergence of a previously unknown pathogen, which has escalated into an unprecedented outbreak and which has been met by an unprecedented response. As I have said repeatedly since my return from Beijing, the Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak, despite the severe social and economic impact those measures are having on the Chinese people. We would have seen many more cases outside China by now, and probably deaths, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world. The speed with which China detected the outbreak, isolated the virus, sequenced the genome, and shared it with WHO and the world are very impressive and beyond words. So is China's commitment to transparency and to supporting other countries. In many ways, China is actually setting a new standard for outbreak response, and it's not an exaggeration. I also offer my profound respect and thanks to the thousands of brave health professionals and all frontline responders who, in the midst of the Spring Festival, are working 24/7 to treat the sick, save lives, and bring this outbreak under control. Thanks to their efforts, the number of cases in the rest of the world so far has remained relatively small. There are now 98 cases in 18 countries outside China, including 8 cases of human-to-human transmission in 4 countries: Germany, Japan, Vietnam, and the United States of America. So far, we have not seen any deaths outside China, for which we must all be grateful. Although these numbers are still relatively small compared to the numbers of cases in China, we must all act together now to limit further spread. The vast majority of cases outside China have a travel history to Wuhan or contact with someone with a travel history to Wuhan. We don't know what sort of damage this virus could do if it were to spread in a country with a weaker health system. We must act now to help countries prepare for that possibility. For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill-prepared to deal with it. Let me be clear. This declaration is not a vote of no confidence in China. On the contrary, WHO continues to have a confidence in China's capacity to control the outbreak. I'll repeat this. Let me be clear. This declaration is not a vote of no confidence in China. On the contrary, WHO continues to have confidence in China's capacity to control the outbreak. As you know, I was in China just a few days ago, where I met with President Xi Jinping. I left in absolutely no doubt about China's commitment to transparency and to protecting the world's people. To the people of China and to all of those around the world, who have been affected by this outbreak, we want you to know that the world stands with you. We're working diligently with national and international public health partners to bring this outbreak under control as fast as possible. In total, there are now 7,834 confirmed cases, including 7,736 in China, representing almost 99% of all reported cases worldwide. 170 people have lost their lives to this outbreak, all of them in China. We must remember that these are people, not numbers. More important than the declaration of a public health emergency are the committee's recommendations for preventing the spread of the virus and ensuring a measured and evidence-based response. I would like to summarize those recommendations in 7 key areas. First, there is no reason for measures that unnecessarily interfere with international travel and trade. So WHO doesn't recommend limiting transfer or trade and movement. We call on all countries to implement decisions that are evidence-based and consistent. WHO stands ready to provide advice to any country that's considering which measures to take. Second, we must support countries with weaker health systems. Third, accelerate the development of vaccines, therapeutics, and diagnostics. Fourth, combat the spread of rumors and misinformation. Fifth, review preparedness plans, identify gaps, and evaluate the resources needed to identify, isolate, and care for cases and prevent transmission. Sixth, share data, knowledge, and experience with WHO in the world. And seventh, the only way we will defeat this outbreak is for all countries to work together in a spirit of solidarity and cooperation. We're all in this together, and we can only stop it together. This is the time for facts, not fear. This is the time for science, not rumors. This is the time for solidarity, not stigma. I thank you.
We now cross live to our correspondent in New York, Sherwin Bryce Pease. Sherwin, good evening, and thank you for joining us on The Globe this evening.
Hi, Lulu. Good to be with you.
Now, Sherwin, what prompted the WHO to finally declare public health emergency?
Well, let's not forget, Lulu, let's just take a step back from this announcement that a week earlier, the same committee of the World Health Organization met in Geneva on Thursday, the 23rd of January, and decided that this was not going to be declared a global health emergency of international public concern. A week later, I think with a great deal of more evidence, the World Health Organization Director General having just returned from Beijing, of course, referencing in that press conference his meeting with President Xi Jinping, really getting a more holistic understanding of the extent of the spread of this virus, not necessarily globally, but certainly in China alone. We have seen some reporting both in the United States and around the world that there was a reluctance, certainly from Chinese authorities initially, to really showcase the extent to which this virus was ravaging central China, the city of Wuhan in Hubei province. But now the DG of the World Health Organization, having returned from this trip, really getting a better sense of the extent of this virus, the extent to which it is spread, and certainly the extent to which China is now responding. Of course, he correctly points out that the virus has spread now globally. He talks about various cases around the world. I can confirm that there are now 6 cases in the United States, Lulu, the first human-to-human transmission of the coronavirus in Illinois, in Chicago, Illinois. A husband of a wife who returned some weeks ago from central China has now contracted the disease. But I can also tell you that the Centers for Disease Control is monitoring over 100 patients in the United States to see if they have contracted the virus. In addition to that, the State Department earlier this week flew from Wuhan 195 United States citizens. They are being kept in quarantine at an airbase in California just to see if they have contracted the virus. To date, no confirmed cases of coronavirus on that flight, that chartered flight that the State Department flew from China. And we also understand that there are plans afoot to bring more United States citizens back to the United States via the State Department in early February. Lulu?
Now, Sherwin, just speaking of the U.S. wanting to bring back their citizens back into the country, he just spoke of the issue of travel bans that mainly have been issued by a number of countries where they want to send out, planes to get their citizens out of Wuhan, China, and other regions of China. What does then this say? Should governments continue with their evacuations of their citizens, or should they kind of hold back and let the process run?
Yeah, the World Health Organization would not dictate to sovereign nations how they will respond to this. This is going to be national decisions. We understand that Dr. Sherwin Pease in South Africa will be addressing the media tomorrow to respond to what the World Health Organization is saying here. Remember, the World Health Organization, pretty much like the United Nations, remember this is the UN's health agency, will advise as to how to respond. But what this declaration of a global health emergency does for the WHO, it allows that organization to issue travel advisories in terms of where to go, where not to go, and how to travel. So they do that independently of member states of the United Nations. In addition to that, it allows for global coordination as to how to respond to this virus. They're not just looking now at China and China's response. They will look now holistically at the global response, better coordination in terms of where funds need to be allocated. He also talked about vulnerable countries in that press conference, poorer countries that perhaps don't have the resources. The state resources often fund the health response in poorer countries. States tend to be stretched at this point, in a global crisis of this nature. So how will the World Health Organization be able to coordinate funds, resources, fundraising, so that there can be a holistic response to this virus? This is what this emergency essentially does. It allows for better coordination. It allows for the World Health Organization to coordinate funds and to distribute valuable resources to where they are needed the most. Lulu?
And he also touched on the fact that we need to give praise to China and how they responded and dealt with the outbreak. As we all know that it's been in the news that the outbreak, it actually started in December sometime last year. And he touched on the fact that their response and how they've dealt with it so far has been quite impressive, looking at China and the country and how big it is, and saying that other countries have also done similar in terms of dealing with the coronavirus. That sentiment, it really says a lot in how we've seen China do something that hasn't been seen by most countries or by most people, building a hospital or 2 hospitals in just a couple of days.
Absolutely right, and I think this is an important figure. There are over 7,700 cases reported globally, 170 dead, but only 98 cases outside of China. We talk about a country like the United States where you have a population of over 350 million and only 6 confirmed cases. So absolutely right. Unlike the SARS virus, which spread so vociferously years ago, I'm sure we all remember that. This has essentially been contained by the Chinese to that central area. Look, I mean, this is an authoritarian government in China that can pretty much do as it pleases in terms of how it will respond to an outbreak of this nature. And I think that's what you've seen. They've quarantined a city of millions. I saw a report earlier that some 57 million people had been quarantined in China. No easy task, but certainly in terms of containing it, they've contained it to China. They're only less than 100 cases globally, and that really does speak to the efficacy of the Chinese response here.
Also, Sherwin, we saw him touch on, a couple of points where he mentioned the fact that, there shouldn't be fiction filtering through globally. It should be more about facts. It's all about science. Now it's focusing on science and ensuring that the coronavirus is wiped out, basically. And, he touched on working together in solidarity as different countries. Just that take, sending the message across that people shouldn't be too alarmed and, believe in science and trust in science.
Yeah, and don't forget, Lulu, that a week ago they said this was not a public health emergency of international concern, and a week later they've changed their tune. So there's also a political dynamic here to consider. Did they act fast enough? Did they have enough information to declare this a week ago? Are they now playing catch-up? So he doesn't also want, countries to panic unnecessarily. This is about science. This is about containment. This is about how quickly we can get vaccines to market. We understand companies like Johnson & Johnson are working quite fast in terms of bringing something to market, but that might only happen over the next 12 months. So you have to contain, but you also have to ensure that there's not panic around the world. And remember that the DG of the World Health Organization is a former health minister in Ethiopia, so he understands the political dynamics that are at play here as well.
And Sherwin, do you think that they will be able to filter information through, as we've seen it coming through, in terms of, how the virus spreads? We've already touched on that as well. And, how the incubation period of the virus, there's been talk about 10 to 14 days and, the quarantine has been working. But what are they generally saying to the public? What should the public look out for and, be wary of in terms of if you are coughing or if you have a dry throat, what do you need to do?
Yeah, I think everything that we've learned in terms of, cleanliness, washing one's hands, if you put your hand up to your mouth if you're coughing, but, wear a face mask if you're in a region that is highly contaminated or where the virus is very, very prevalent. We use public transport in big cities like, in the United States, New York, around the world, London. Many big cities in China where millions of people use public transport. You have to interact. Your bodies are often back to back on subway trains, so it's important to be aware. And I think public information is very, very important. The United Nations will be used certainly as an avenue to distribute World Health Organization information to member states. And really, in terms of more vulnerable states, that really is going to be the big concern here, the big focus. China seems to have the funds and the ability to respond quite quickly and quite vastly in terms of their coverage area in combating this, but there are more vulnerable states out there. The World Health Organization DG talked about Germany, for example, Japan, Vietnam, and the United States, where we have now seen human-to-human transmission. But that really is very much a minority. The big concern here is going to be, are we going to see an increase in human-to-human transmission? And to date, those numbers are still quite low. The point of this emergency declaration now is to ensure that that is maintained as such.
Sherwin, it is a developing story, and we're all watching very keenly with regards to how this rollout is going to happen and the role that we chatted about with regards to the WHO and how it filters through, as we touched on, to the weaker countries and taking it forward and ensuring that the coronavirus is dealt with globally. Thank you so much for joining us this evening.